Sandy Houck was dealing with one of the risks of aging, falls.
I don't know whether it was my eyes or just my balance. I think when we are aging, and I am 80, but when we're aging, we just seem to lose our balance for some reason.
Sandy went to see Dr. Konstance, her cardiologist.
In fact, Dr. Konstance said, get your husband to buy you a diamond-studded cane for Christmas. He told me that last year. Well, anyway, he didn't.
She's had permanent atrial fibrillation since I've known her. And as most people know, atrial fibrillation puts you at risk for stroke.
And he said, there is a procedure that will help prevent strokes.
The Watchman device is something that's been on our radar for quite some time. She was among the first group of patients that I recommended it for.
Then, just 3 days after that visit,
after I was off of blood thinner, I had another stroke. So that was my third. And it caused my face to be all distorted, and I just looked like a monster the morning I woke up with it. So I was in the hospital then that was on a Monday through Thursday. Dr. Konstance was the first one to come and see me. He was wonderful to me during that period.
Dr. Konstance connected Sandy with Carilion Clinic's structural heart program.
The Watchman is a little gizmo about this size that looks like an umbrella, sort of, or a parachute, but it has little metal ribs.
I think an umbrella or parachute with little metal ribs is a darn accurate way to describe it.
Dr. Foerst is an interventional cardiologist at Carilion Clinic who performs Watchman implants. The Watchman is inserted through a vein in the leg up into the heart, where it's implanted into the left atrial appendage.
The left atrial appendage is this sort of little nook that hangs off the front of the top chamber of the heart. And with the atrial fibrillation, the blood is just sort of sitting there because the top chambers of the heart are sort of squirming rather than contracting. So the blood likes to clot when it doesn't move, and it tends to sit in this little nook. So the concept of the device is to exclude that nook from the rest of the heart.
There's less of an opportunity for blood clots to form, those blood clots being the presumed source of stroke in the patients that are at risk, like Mrs. Houck.
I hope that the Watchman is going to prevent more strokes. So far, it's been wonderful. It was such an easy procedure.
And there's another benefit for Sandy. The Watchman may make it possible for Sandy to come off blood thinners.
Well, I won't bruise so easily, so I won't have ugly hands and have to wear long shirts.
There's no question that without being on potent antiplatelet therapies or blood thinners, that bruising will tend to be better.
Sandy can now go on judging flower competitions, playing with her grandkids, and enjoying life without the fear of having another stroke.
I hope and pray that my telling this story will help others know that this is a wonderful thing that they have come up with.
She is going to thrive. I have no doubt about it. She's hopefully done with having strokes, and hopefully she gets her diamond-studded cane. We'll see.